I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. This is Dr. Fiona Lovely. Thanks for joining me on the Not Your Mother's Menopause podcast. Today, I have an expert on thyroid to share with you. And Dr. Amie Hornaman and I recently had a really interesting conversation. Now, listen, I've been talking about thyroid and talking to women about their thyroid function for a lot of years. But Dr. Amie had a lot of stuff that I had not heard before. And specifically, we talk about how the thyroid affects weight and metabolism. That was a big part of our conversation. So if you have a thyroid disorder or you think you have a thyroid disorder, but no one's ever confirmed it, this is the conversation for you. So let me introduce Dr. Amie Hornaman, known as the Thyroid Fixer, is a prominent figure in the field of thyroid and hormone optimization. She hosts the globally recognized podcast, The Thyroid Fixer, which has become a leading voice in medicine and alternative health. As the founder of the Better Thyroid and Hormone Institute, Dr. Amie advocates for the principle that better thyroid and hormone health equates to better life. In addition to her educational efforts, Dr. Amie has developed the Fixer supplement line, a range of groundbreaking supplements designed to address the common health issues she observed in her patients, such as difficulties with weight management, fatigue, hormone imbalances, and more. These products, alongside her personal one-on-one programs, form the core of her mission to restore health and vitality to her clients. Dr. Amie's passion for thyroid health was born from her own personal health challenges, and we talk about that. That's where we start this conversation, is what she went through. While competing at NPC figure competitions, she encountered severe symptoms and faced multiple misdiagnoses and ineffective treatments. This experience ignited her commitment to help others who are navigating similar health struggles and the often confusing medical landscape. Her approach to health is comprehensive and empathetic. Dr. Amie provides insightful, often overlooked health information, equipping her patients with the tools of personalized treatments necessary for recovery. She emphasizes a holistic view of health, focusing on optimizing thyroid and hormone functions beyond just lab values. By considering all factors that contribute to thyroid dysfunction and symptoms, Dr. Amie aims to not just treat, but transform her patients, enabling them to embrace their full potential and lead healthier and more fulfilling lives. You know, sometimes you just meet somebody and you're so certain that y'all have spent time together in another lifetime. Well, that was me and Dr. Amie. We had a great conversation. And if you enjoy it, by the way, she has interviewed me for her podcast as well, called The Thyroid Fixer. Please go over there and have a listen. And I'm speaking to her on the cognitive impact of menopause. So back to this conversation. You know, Dr. Amie said that it's estimated that 60 million Americans in particular, although I know I've got listeners all over the world, so this is the statistic I have. 60 million Americans are have undiagnosed thyroid disorders. So this is a very, very common problem for a lot of people. And Dr. Amie and I talked about the standard of care in medicine when it comes to thyroid is inadequate. And we do know better. And, we want to see those things change sooner rather than later. So whether you are hypothyroid or Hashimoto's thyroiditis or you have thyroid nodules, Dr. Amie had something to share. Really interesting stuff. She talked about thyropause, which is why we see thyroid issues come up at the menopause transition. So, on that note, please tune in to this really great conversation I had recently with Dr. Amie Hornaman, the thyroid fixer. It's important to me that the supplements I use are of the highest quality, and that's why for more than 3 years I've been drinking AG1. It is researched and developed by an in-house team of scientists, doctors, and nutritionists with decades of experience in their respective fields. Quality for AG1 isn't just a buzzword, it's a commitment backed by expert-led scientific research, high-quality ingredients, and rigorous testing. I know I can trust what's in every scoop of AG1 because they obsess over product quality, the standards of manufacturing partners, and sustainable practices. It's easy and fast to use. Drinking AG1 mixed with water in 1 scoop a day covers my nutritional bases. Prebiotics, probiotics, digestive enzymes for gut support, B vitamins and rhodiola for energy support, folate, magnesium, and ashwagandha for stress support, and vitamin C and zinc for my immune health. So if you want to replace your multivitamin and more, start with AG1. Try AG1 and get a free 1-year supply of vitamin D plus K2 and 5 free travel packs with your first subscription at drinkag1.com/Fiona Lovely. That's drinkag1.com/Fiona Lovely. Okay, I'm Dr. Fiona Lovely, and today I'm joined by Dr. Amie Hornaman of the Thyroid Fixer podcast. Welcome to the show, Dr. Amie.
Oh my gosh, I'm so happy to be here. You know that I love you. So this is going to be a fun conversation.
It is going to be a fun conversation. We have so many things in common that we're passionate for. So you became known at some point as the Thyroid Fixer. Can you tell me a little bit about that story?
Yeah, I mean, so many of us are here because of our own pain to purpose journey, going through crap that we have to figure out for ourselves. So we can bring it to the world. My story was no different. It started about 27 years ago when I was competing. So I was in my 20s at the time. I was competing in fitness and figure competitions. So really dieting down hard, asparagus, broccoli, chicken, fish. That was the diet. I would go to the gym twice a day. I mean, it sounds crazy. It was a little bit crazy, a little bit extreme, but it was a challenge. I really, really loved doing these shows because they were challenges. And I had done plenty of them. I mean, maybe 20 different shows and different photo shoots that I would diet down for and get my body. The goal was to get the body into a low body fat state, but keep your muscle. So the diet and exercise regimen was really strict. I had a coach and I was getting ready for this one show that was a bigger show and checking in with my coach, getting on the scale, sending him progress pics, all of that. Been there, done that before. But this time, every time I got on the scale, it went up. Like 5 pounds, 10 pounds, 15 pounds, eventually 25 pounds. Now I'm 5'2". So 25 pounds on a 5'2" frame while doing all the things, while eating, I mean, perfectly, while going to the gym twice a day. That didn't even make sense. I don't care whether you believe in calories in, calories out or not. I was burning way more energy than what I was taking in, which did not equate to my body putting on pounds. It just didn't even biologically make sense. So I went to my doctor. So, you start with your PCP, go in, hey doc, here's what's going on. I have no idea what's happening. My body's rebelling against me. What gives? And I remember he looked at me, he ran some tests. I don't even know. I would love to go back and see which tests he ran because we know it wasn't thorough at all.
No, it was probably TSH and T4 and that's it.
Yeah. I mean, let's be honest. I'd be lucky if I got that right. But I was still told you're normal. So wherever those numbers came in, he's like, you're normal. Everything's fine. And I left there. I'm like, oh my God, no, I don't feel normal at all. I don't feel fine at all. So I'm going to get a second opinion because that's what we do. So let's go to doctor number 2. Went to doctor number 2. I mean, same thing. It was, no, you're normal. Everything's fine. I remember he pointed at a BMI chart in his office and there was a Christmas party going on that he was in a hurry to get back to. And I left there so frustrated. Now, I mean, now that I was on doctor number 2 and still didn't have the answers, this is where the frustration and depression set in. So I was wearing big sweatshirts at the gym. I felt like I was being judged by everybody, whispering behind my back, oh, she's eating the donuts, she's not sticking with her diet. But that wasn't the case. I really was doing everything. So then I kept going. I went to actually doctor number 3, 4, 5, and 6, who all told me I was normal and everything was fine. Now, I reflect back on this quite often and think, oh my God, what if I would have stopped at doctor number 4? How about 5? Because that's a lot of medical professionals telling you that you're normal. It must just be you. It's all in your head. One of them told me to eat less and exercise more, which was literally impossible to do. So finally, I go to doctor number 7. I'm like, this is it. This is it. If they don't have any answer for me, I'm hanging it up. I'm accepting my fate of whatever it is, whatever. And she actually touched my throat and said, swallow. And she's like, oh yeah, okay. You have a growth on your thyroid. We're gonna get it ultrasounded. But here's what I'm seeing in the labs. You have Hashimoto's, hypothyroidism. Here's a pill. Oh my God, Fiona, I was so pumped up. I left that office like celebrating. Like I have a name for what's going on with me, and I have a pill that is going to fix me. And I gave it 5 months and then nothing. I mean, there was no weight loss, no change in how I felt. And I looked up what she gave me. It was levothyroxine T4. And I'm doing some research and I'm seeing, okay, wait, T4 is the inactive thyroid hormone. There's all these other thyroid hormones. There's T1, there's T2, there's T3. She's giving me the inactive thyroid hormone. Wow, that doesn't make sense. Okay. So I went back to her. I said, what about all these other thyroid hormones that are active and that seem to actually give people a metabolism and let them lose the weight and make them feel better? She goes, oh, well, I don't do that because that's not standard of care.
Standard of care. Yep.
Like, okay, yeah, because we all fit in a box, right? Okay, so I'm going to find somebody who does. Thank you. Fired her and found functional medicine. That functional medicine practitioner that I saw. And, it's funny because, when the universe gives you multiple signals and you just keep not listening. So you get like punched in the face by the universe because you're not listening.
I
do. Right. So I kept hearing his name multiple times. Finally, I'm like, okay, I hear you. I'll make the damn appointment. So I made the appointment with him finally. Took me like 3 months to get in, of course, because I procrastinated. And he sat down with me for 90 minutes. There was probably like 15 vials of blood that came out of me. I had no idea what he was looking at, but I'm like, all right, let's do this. And he sat with me for 90 minutes going through my labs, telling me exactly what was going on in my body. And he made a plan to fix me. So it was not Levo. Eventually, I started on Armor. He changed me over to Armor Thyroid, which is natural desiccated thyroid. Eventually, I progressed to find out that I am T3 only. So now I'm on T3 monotherapy, which is way outside of conventional medicine thinking.
Yeah.
But he changed my life. And from that point on, I changed my career and he became my mentor. I got into functional medicine, obviously specializing in thyroid and hormones, because I was in a major medical system as well. I like to mention that because so many people think like maybe I was in, Podunk, USA. I was in the UPMC Pittsburgh medical system, which is the equivalent to Mayo Clinic, Cleveland Clinic, all the big teaching hospitals, the big clinics that everybody flocks to because they think they're going to get the best of care. And I still got misdiagnosed 6 times and mistreated once. So you have to, that's a message that you have to break outside of the norm. And that was a message to me that I need to do this because there are a lot of women in a lot of states that are getting the same message from their doctor. You're normal. Everything's fine. It's all in your head. So that's what led me here.
Wow.
Yeah.
Oh, so many places so many threads I want to pick up here. I think your story is, well, I know your story is going to resonate with a lot of women, and I'm going to guess that you have seen that in your career because now this is what you do is to take care of women that potentially have thyroid issues, correct?
Yes, absolutely. Yeah. Thyroid and hormones, because they tie, I mean, as you know, they tie so well together.
Yeah.
Where we see one problem over here, we're going to see a hormone problem over here, and then hormones affect the thyroid. So, yeah, everything blended together.
So what happens to the thyroid at perimenopause? Because we quite often women don't hear a darn thing about their thyroid, and then all of a sudden there's all these symptoms at peri-em, and now we have a conversation about thyroid.
Yeah. Well, I'm actually calling it thyropause because really, if you're over the age of 40 and your hormones are starting to change in perimenopause, chances are you have a thyroid problem. The reason I say that and can say that with confidence is that we know that just like the sex hormones start to get depleted and not function properly, not function at the youthful level that they once did, the same thing happens with our thyroid. And on top of that, when hormones start to shift, now we can see this in pregnancy as well, because that's a huge hormonal shift in a woman's body. But in perimenopause, menopause, when those hormones start to shift and downgrade themselves, start to fall off a cliff, basically, that's enough of a stressor in a woman's body to turn on the autoimmune switch of Hashimoto specifically, which is hypothyroidism. We know that with autoimmunity, there has to be that trigger. And one of the triggers is any kind of stressor. We have to remember that hormonal changes are a huge stressor to the body. So yeah, pregnancy is totally natural. We're built to do it as women. Huge stressor on the body. Your hormones are fluctuating like never before. You're gaining weight at a rapid pace. You're carrying another human being. That's a stressor on the body. So a lot of times we'll see Hashimoto's present itself after pregnancy. If it doesn't hit then get ready, ladies. As soon as you head into perimenopause and menopause, that's usually where the Hashimoto switch turns on.
I want to come back to standard of care that you talked about as well. By the way, Hashimoto's, for the listeners, I think I would say my listeners are fairly well read in on hashies, but just before we move on to standard of care, can you kind of give us an idea what's the difference between hashies versus hypothyroid versus hyperthyroidism?
Yes. Okay. So Hashimoto's is the autoimmune form of hypothyroidism. So hypo, low and slow. Think of it that way. Everything in your body is low and slow. Your metabolism, your brain function, your gut motility, hence constipation, hair growth, skin cell turnover, heartbeat, body temperature, blood pressure, everything starts to go down. So everything is low and slow in that hypo state. Of all the hypothyroidism, all the low and slow thyroid function that we see, 95% of that is Hashimoto's. Now we test that. How do we know? We test that by testing TPO and TGA antibodies. And here's where a lot of people get misdiagnosed, told that they don't have Hashimoto's. Number one, antibodies often come back as a false negative. So you really want to retest those often, because just because it says 0 today, it doesn't mean that 4 months from now, 5 months from now, it's going to say 0. So you just can't do, I mean, when you think about it, it's almost as crazy as us testing your glucose today and then being like, you're good.
Yeah. That's absurd.
I mean, like, wait,
That's
what?
absurd.
It can change. So yeah, we want to test those antibodies multiple times. Number two of that is that the lab for the antibodies, your antibody number should be 0. If you have 5, 10, 20 antibodies and they're not being flagged on the lab and your doctor's like, no, you don't have Hashimoto's, I want you to think of it this way. So when we're talking about autoimmune, when we're talking about Hashimoto's, you have soldiers that are going out and attacking your thyroid because they think the thyroid is a bad guy and they're very confused. That's what autoimmune is. You have these soldiers that are attacking XYZ of your body. So if you have rheumatoid arthritis, those soldiers are attacking your joints. If you have Crohn's disease or celiac, attacking your gut, small intestine. Same thing with Hashimoto's. Those soldiers are going out and attacking your thyroid gland. Now, if you start beating up an organ or a gland, it's probably not going to work as well as it once did, because it's really tired. Like if I beat you up every day, Fiona, you're not going to be the best podcaster, the best, host, the best anything. So same thing with the thyroid. Whenever we beat it up every single day, it's not going to produce the thyroid hormones that we need it to produce. So any antibody on your labs, think of it as soldiers that are going out and attacking your thyroid. oftentimes women will get told that they don't have Hashimoto's, but then I look at their labs and I'm like, yeah, okay, but you have 20 soldiers. And I get it that the lab cutoff is 34, but are we going to wait until you gain another 20 pounds and literally can't get off your couch to officially, diagnose you with Hashimoto? Like, no, come on, let's address it right now because we're seeing something going on.
Yeah. And this is actually brings us back to the standard of care because, there's much opportunity for improvement in the standard of care in Western medicine. And I know for me, when I started looking at women's hormones, 20 years ago when I was new in practice, and I was really aware that the thyroid testing that was being done was very much not great. It was just a small portion. For example, we talked about TPO and TSH, and we've talked about T3. So if a woman goes to her doctor now, this is certainly true where I live, and says, I've got these sort of vague symptoms, what do you think it is? And the doctor suspects thyroid, TSH at the very minimum. That's pretty much it. And so for listeners, that's how the brain is trying to signal the thyroid is what's happening. So that's really only looking at whether or not there is a complete message that's happening or a message that's appropriate between the brain and the thyroid. And for what you're saying is 95% of hypothyroidism, which is by far the more likely of what, not very often I see hyper. I've seen it maybe 2 or 3 times in 20 years. Right?
Yep. Same. Yep. So, exactly.
Right. It's pretty rare. I've seen one thyroid storm, although after the fact. Thank God it wasn't in my office that I saw that. It's been terrifying.
Right.
Anyways, it was for her. But so if 95% of women with hypothyroidism are Hashimoto's and the standard of care is incomplete, that means there's a whole lot of women out there that are not getting, not just about diagnosis, but not getting helped appropriately. And I think this is a bigger conversation when we're talking about menopause for sure. So I'd love to hear your thoughts.
Yeah. I mean, I saw a stat one time, I mean, just recently within the last 6 months that stated it's probably around 60 million just Americans. They didn't even include Canada in that. 60 million Americans that are undiagnosed.
Ooh, and like 60?
Yeah, 60 million.
Wow.
Which, I mean, really isn't that far off, because if you figure that practically every woman over the age of 40, 45, after you enter into perimenopause and menopause, I mean, really, honestly, short of being just this genetic freak that nothing hits you, you run through the raindrops, whatever. But if you're like the rest of us, chances are that you are going to start experiencing symptoms in your 40s. The weight's going to come on, the midsection gets a little bit wider. You can no longer control your glucose. Your sleep gets all effed up. You start to lose hair. You're like, what the heck's going on? Yeah. And, it's very common to think it's your hormones, which it could be, but thyroid and hormones play together. So when we look at the amount of women turning, let's say 40, 41, 42, 43, 45 today, yeah, okay, it could be 60 million, because then what about tomorrow and the next day and all of these women that keep getting told that they're normal and everything is fine? Absolutely, it could be that high.
Wow. That's mind-blowing. And when I hear that, I think, my God, girlfriend, you and I got some work to do. Right?
We can do it though, but that's the thing. Yeah. And that's the message that I really love to put out, is that you have to have hope and you don't stop. So it's never too late. It's never too late to address your health. It's never too late to get optimized. You don't have to throw in the towel. And that's really the message that's being given by even conventional medicine. Doctors are guilty of this, of basically telling women, well, you're getting older. This is just something you have to get used to. I have heard of a woman physician telling a female patient, you're just getting older. This is just something you have to get used to. I'm like, oh, are you going to accept that when you turn 50? Or are you just going to throw in the towel and be like, well, here it is, 50. Psh, I don't have to care about my health anymore. I'm just going to eat bonbons and be bald and tired all day. That's cool. Like, no, that's unacceptable.
Well, and we have to recognize too that the patriarchy, of course, keeps women in the system, the paternalistic medicine system, just as hostage as the dudes, right?
Yeah. Yeah.
So, you don't, but I always say to my patients who are like, well, my doctor should know she's our age. She's, this and that. And I was like, yes. And she's been trained in a system that trained her away from naturally understanding and knowing how to take care of a woman and a woman's body, because I think it's completely unacceptable that
Yeah.
we have allowed women's health to be mammograms and pap smears. It's
Mhm.
unacceptable.
Yep.
So, and you and I know that because we look at these things all the time and say, actually, there's far more nuance to it, right?
Yeah.
Anyways, I'll get off my soapbox about that. But what I was wondering about, actually, there's a couple of things, but let's start with thyroid nodules. You mentioned thyroid nodules, the doctor that actually touched you and said,
Mhm.
there's thyroid nodules here. Now, what can be done about those?
So with thyroid nodules, well, a couple of things I want to also lead off with. A lot of women have thyroid nodules and have been told by their doctor, not a big deal. We're just going to watch and wait and keep an eye on them. What other organ or gland in your body can actually have a growth on it that we go, you know what, it's not a big deal. We're just going to keep an eye on it. Except the thyroid. And it's like, no, when your body produces an abnormal growth, that's your body's signal that something is wrong with that part of your body, that organ, that gland. So number one, we have to properly treat the thyroid. And by properly, I mean not T4 only. A T4 only does not work. It does not work. So we have to address thyroid function and the thyroid hormone balance and get that person on the right thyroid hormone replacement in the right dose that they need. So that's a whole nuanced art that we can go down that rabbit hole. But number one is the proper thyroid treatment. Number two for nodules is iodine. Now, iodine is hugely controversial in our world. I get that.
Mhm.
I am very pro iodine, and I base that in common sense and biology. So, biology says that every cell in our body needs iodine. We know that iodine competes at the cell receptor level for bromide, chlorine, or chloride, and fluoride,
Fluorine, yeah, fluorine,
fluorine, fluoride.
yeah, yeah.
So, if you don't have enough iodine in your body, then those toxic halides will attach to your cell and wreak havoc. And those three are the most toxic to the thyroid. So iodine not only reduces goiter or nodule sizes, it's also protecting your thyroid. It's protecting your cells from those toxic halides. It's detoxing your body. It's helping your immune system. It helps with hair loss. I mean, it helps with so many different things. So I'm a fan of using just, the proper amount of iodine, nothing too crazy. Like you mentioned, a thyroid storm. We see that only with the crazy high doses, or someone that started off with, let's say, 50 milligrams and they've never taken iodine before. They can absolutely go hyper that day or get a thyroid storm. But 99% of the time when people do it correctly, it's very well tolerated and does nothing but help.
Yeah, and what's interesting about iodine, I'd love to have a deeper conversation about it. There is the whole iodophobia thing that's happened due to poor research that was done. I think it was 1912 was when that paper was written. I read it many years ago, like a really long time ago. And there's still that fear of iodine because of that paper. But for me, when I'm suggesting to a patient that they need to be consuming some iodine, I like to tell them to get it in the food source. That's easier. Now, what I will tell you, we can't get Lugol's here in Canada. They will confiscate it at the border. I've tried,
Oh,
just
yeah.
bananas. So the only iodine we can get is the stuff you can clean wounds with.
Okay.
So then we have the conversation about, and keep in mind that, the listeners to the show are from around the world, so they may not have the same access as in America and what supplements are available in America. But I know that we can do like a kelp or a seaweed capsule, although I know there's the whole concern about where it comes from, if it's from Japan, where they had the Fukushima business. So can we
Right.
talk about all of that, please? Because what is a woman to do if she's not getting help from her doctor, and she's not in either of our clinic space? Then what can she do if she thinks she needs this?
So let's start with the iodine, then we can even go, what can she do if she needs better thyroid treatment too. For the iodine, listen, if you cannot, I am a fan of Lugol's. I'm also a fan of nascent iodine, the violet iodine, all of those forms, totally cool. Even iodoral in a pill form, if you can get that in Canada, it's not ideal because it usually starts at a 6.25 or a 12.5, and a lot of people have to start less than that
At
milligram
the
wise.
tablet. Yeah. Yeah.
Yeah, I mean, that's the beauty of the drops. You can start so low and just gradually titrate up. But if you can't get the drops, then go to the iodoral form, or like you said, go to the whole food sources of seaweed, kelp, kelp tablets, spirulina, all of that, just so you're getting something. You might not be able to hit that 25 milligram to 50 milligram dose that's talked about by Dr. David Brownstein. That's where he has found with his research to be that sweet spot where iodine really makes a difference in the body, including even cancer prevention. But if you can't quite get to that dose through whole food sources, getting some is better than none. I mean, that's the bottom line. Getting some form of iodine is better than zero.
Yeah.
Yeah.
Okay. And do you recommend, let me start a different way here. Anytime we look at sort of the multivitamins, they are micrograms is what they measure iodine in because of this. So they're just simply not adequate. So can we talk about if that's the case, if you're taking a multi and you think you're getting your iodine and you're all good, like what I usually tell women in that case is make sure you have sushi a couple of times a week if you like it, because the nori wrap, of course, has that.
Yep.
I would rather die than eat the nori, so I'll take the fish and the rice are all good. It's just I
Tell
don't
me how
like
you really feel, Fiona.
I know, right? Please hold. Let me make a list. So I always say that's a good start to do it that way. So, how do you feel about the multivitamins and etc.?
Yeah, I mean, multi is just kind of fairy dust, the ingredients. So they're
Yeah.
good for kind of a baseline coverage, but then you have to go deeper with what I call the no dust supplements, which it's like, duh, of course you're going to take these every day. That would be your vitamin D, iodine, if you can get it, magnesium, but the Bs, all of the Bs, B12, B6, you're going to need higher doses of those to really support your body. So you could take a multi just to cover the base layer, so that you're not taking 60 different individual supplements, but you're probably going to have to stack that with the individual supplements at a higher dose to adequately raise your levels.
To get the goodies.
Yeah.
So if you would rather not answer this, that's fine. I totally understand. But is there an RDA for iodine that's actually acceptable?
Well, I mean, gosh, if you're talking about our government's RDA.
No, I'm not.
Okay. I was going to say that's like piddly poop. And what do
It
they
is.
know
It's not.
anyways?
Yeah.
Yeah.
It's not even a milligram, I don't believe. I think it's like 400 micrograms or something, isn't it?
Yeah. Yeah. No, you know what? I follow David Brownstein's work. I respect him so much. But I also find that not all of my patients, which he does talk about this too, not everybody's going to be able to hit that 25 to 50 milligram mark. They'll get really jittery. So my patients will ask me, well, what do you mean I have to go slow? What should I look for? And I said, well, if you take too much iodine and it's not the right dose for you, or maybe you titrate it up too quickly, you're going to get really hyper. It's going to feel like you drank 10 cups of coffee. Don't worry, that's not going to last. And actually, by just taking a lot of salt and salt water, that calms down and balances out that iodine. And you'll be fine the next day. Now okay, if you just took 25 drops, back it back down to your last dose of 20 drops or 15 drops. But you just have to go low and slow, and maybe you might find that you're not able to get above 12.5 milligrams. And when you go up one drop above that, that's it. The day is shot. You're icky and sticky and jittery and anxious, and it's a no-go. Okay, that's fine. Then stay there. You just have to find your sweet spot for iodine.
Yeah, and this makes me think of something I haven't thought of many years. When I first started taking iodine, it's the same thing. That's exactly what I was told. Probably when I was doing my functional medicine training, same time you were, was just start to introduce it, and introduce it slowly and notice what you notice. And I remember one day all of a sudden having one really itchy boob. And I thought, well, this is fascinating. That never happens. But if you look at the research around iodine, we know that there are certain body parts that like iodine, and breasts are one of them. And in
Mm-hmm.
fact, there is that link between low iodine and breast cancer, which I think is fascinating how we never hear about that. Isn't that fascinating?
Iodine's too cheap.
Oh,
It's too cheap. It's not a big pharma. God forbid you actually protect a woman from going through chemotherapy.
I know, God forbid is right. You're absolutely right. And to my listeners who are enjoying the show with Dr. Amie and I, if you'd like us to do an episode where we go deep on that, I'm sure Amie would come back and talk to me about that, and I'd be happy to discuss what I know as well about it, because that is absolutely one of those little bits of information that gets repressed and hidden, etc. Okay, we'll move on from that. So but anyways, what I was saying was that I noticed that I would get an itchy boob whenever I got to a certain level of iodine. And I went, okay, well, that's my sign. The
Mm-hmm.
other thing that would happen is I would have these burps like I had swallowed swimming pool water. Isn't
Oh
that
yeah.
so interesting? Have you had
Well,
that experience, or you had
well,
others?
what's probably happening is you're detoxing chlorine.
Sure, sure,
Yeah. Yeah.
absolutely.
Well, I
Yeah.
always say when you take iodine, it tastes like you're licking a Band-Aid. I mean, it just brings back those
Yeah.
memories of having a boo-boo and your mom put the iodine on it, slap on a Band-Aid. I don't know. It tastes like you're drinking a Band-Aid, but
Yeah.
the chlorine is another one. Yeah.
Yes, yeah, absolutely. That's how I took it. I took it as a sign. When I got to the point where I had the itchy boob and I was burping pool water, I was like, okay, well, I'm good. I'm good. I wouldn't push it. Now, maybe based on what you're saying, I maybe could have pushed it farther, but we will leave that to see what the listeners have to say. Because if they want us to come back and talk about that, I say hell yes on that.
Do it.
If
Yeah.
yeah, if you do that. Okay, the something else I want to talk about before we get too far away from your origin story is you talked about being in now you had a term for it, fitness and body competitions, I think was the term you used. Is that right?
Yeah. Fitness and figure. So
Figure, that was it. Yes.
yeah, it's kind of in the bodybuilding realm. But back when I competed, it's not so much anymore. But back when I competed, figure was still very girly, I want to say. Like the women who competed in figure didn't look like bodybuilders. They weren't big and bulky and manly. You still had that feminine shape with athleticism to it.
Yeah, okay, fair, fair, fair. Over the years, I have seen a number of patients who were premenopausal, so still well in their reproductive years, that had a very low functioning thyroid because of extreme weight loss or extreme diets. And I've always wondered about that. And I suspect you are the exact right person to ask about what that's about. Like, I've seen it be as extreme as like anorexia, bulimia kind of thing, but I've also seen it be just these weird extreme diets that women tend to do. Hopefully we're not doing those anymore, but you know what that era, right?
Yep. Yep.
Tell me
100%.
what that's about.
So that 5%, we said 95% of all hypothyroidism is Hashimoto's. 5% is just hypothyroidism, direct, meaning maybe you were taking a medication like a beta blocker or even birth control that can tank your thyroid. Maybe you were over exercising, under eating, like you said, not even necessarily an eating disorder, although that will do it,
Yep.
but even anything extreme. So what I did was absolutely extreme. Competing in bodybuilding, fitness figure is extreme. You are doing something to your body for those 12 or 14 weeks that no one would ever choose to do unless they're in that competition mode. Now, of course, I mean, we can look at Olympic athletes and say, well, they kind of do the same thing, rigorous training, all of that. Yeah, but their nutrition is a little bit better because now we know more. And we know
Yeah.
way more now than we did back in the early 2000s when I was competing, 90s and 2000s. So back then it was just caloric restriction, really, I mean, super low fat diets, high
Oh,
protein, of course.
yes.
It was all over the place. So I have no doubt that competing and just doing those extreme diets contributed to my hypothyroidism. But for me, it was more that was a stress on the body that flipped the Hashimoto switch. Now, to
Wow.
your point, there can be that direct effect that just through long term dieting, over exercising, even over fasting. We're seeing that these days where these women are doing OMADs or they're doing 18 hours of fasting every single day. That ends up tanking their thyroid function. So it can be a direct effect based on how we're living.
Yes, it's so true. The fasting conversation, as all things, we're getting far more nuanced about when and where and who that's acceptable for. And I have always said from the beginning, for women in perimenopause to put them on these 36-hour fasts, like they're poor adrenals. I just want to crawl in there and hug the adrenals, right? Like, just slow your roll. So this is what I always say is just a lot of the information that's out there is based on a man's body and the research around a man's body. Women need to do fasting differently. And I thank you for saying that, because I have seen the fasting trend become an eating disorder real fast in a great deal of women. So I'm very careful now. I think probably when I started fasting in 2020, which I was kind of late to the party, I was so enthusiastic about it. I was just talking about it all over the place. As long as I said, just, be careful of your adrenals. If you're stressed, if this is not the time to do it. But we know so much more. We know so much more, but I love to hear that. So thank you for sort of qualifying that and bringing that in, because I think that's really helpful information. Mitochondrial health is a critical piece of longevity and aging well. But where do we learn how to take care of our mitochondria? The powerhouse of the cell, providing us energy and strength. Mitochondria are in every cell in our body, our brain, and our muscles. Menopause is a time of reduced energy, causing fatigue, muscle loss, brain fog, changes to skin appearance and body composition, reduction in strength and endurance. These changes aren't just annoyances, they can seriously impact overall health and longevity. I get help with this using MitoPure from Timeline Nutrition. It's a clinically tested urolithin A supplement that rejuvenates the mitochondria. These innovative products use this natural compound to trigger an anti-aging pathway in our cells called mitophagy. The research behind MitoPure is robust and impressive. I feel stronger and more energetic since taking the MitoPure soft gels. I've seen the science, and I rest well knowing how MitoPure is working to rejuvenate my mitochondria. The serum leaves my skin smooth and hydrated, and I've seen the fine lines around my eyes and forehead get softer with my very first use. It's a moisturizing powerhouse with longevity benefits. Yes, please. Timeline is offering our community 10% off your first order of MitoPure. Visit timeline.com/lovely to learn more. That's timeline.com/lovely. TIMELINE.com/LOVELY. So I want to talk about T2 because I've heard you talk about it quite a bit. Can you kind of give us what we need to know about T2?
Yeah, absolutely. So rolling back in the conversation, when I was talking about being given that pill, I was given T4. And I've already said T4 only doesn't work. So any ladies on Levo, Synthroid, and that's all you're taking, and your doctor just keeps raising it from 50 to 88 to 112 to 125, and you're not getting any better, that's because you're taking T4 only, the inactive thyroid hormone. Now, there's other thyroid hormones. There's T3, that's in prescription form. So your doctor has to be on board to prescribe T3 and know what they're doing with that. And then there's T2. Now, T2 is not in prescription form. It's in supplemental form because it doesn't have a direct effect on the thyroid. And I'll explain. T2 will come in and increase the basal metabolic rate. So the amount of fat that you're burning at rest, it will increase that. It will increase thermogenesis, so the burning of stored body fat, but it works at the mitochondria level. So it works directly on your mitochondria instead of working on your thyroid, kind of like, poking the thyroid to produce more, like we see with medication. So scenario, you take T3 and T4. That's going to have a negative feedback loop on your thyroid. Now, this is not a bad thing if we are getting you optimized. If we sat down, we looked at your labs, okay, Mary, you have really low T3, you're gaining weight, you're tired all the time, you tell me your hair's falling out. So I'm looking at your labs here, your T3 is in the toilet, your reverse T3 is too high, you're just not on the right medication. We're going to change this up. Now that will produce a negative feedback loop on the thyroid. TSH will go down. And if Mary goes to conventional medicine is going to say, Mary, you're hyper. Give me that thyroid medication. We're going to take that away from you. And Mary is going to be like, yeah, but I feel good. They're going to be like, no, we're going to take that away from you because that medication had a direct impact on your thyroid production. T2 doesn't do that. So you can take all the T2 in the world. You don't have to worry about, going to Dr. Joe and Dr. Joe saying, okay, Mary, you're hyper. We need to do something to slow your thyroid function down. And you're like, but wait, for the first time in my life, I feel good and I'm losing weight. So T2 works at the mitochondrial level and it stimulates ATP production. Now, what that means for us is that we have nice, steady energy through the day. And that's really important for those in a hypothyroid state or stuck on T4 only because you're pretty much dragging. I mean, that hypothyroid low energy is just indescribable. You are literally dragging yourself through the day if you're even able to. Sometimes you have to lay down and take a nap because the exhaustion is just really real. But by taking T2, we're just producing that ATP consistently through the day. So it's a really nice steady energy while it's working on building up your metabolism and increasing your basal metabolic rate. The other thing that T2 does is it acts as an exercise mimetic. So it's actually stimulating mitochondrial uncoupling that produces thermogenesis. It lowers leptin. It improves insulin resistance. All the things that exercise does, burns body fat. Okay, then we can flip over and we can look at T2. Lowers inflammation, lowers insulin, lowers leptin, reduces fatty liver, improves cholesterol. So it acts like an exercise mimetic as well. So I love T2. I absolutely love it. And even just a quick story when you had mentioned bodybuilding, so I'll bring that back up again. Yes, there's the, extreme dieting, but there's also, let's be honest, some drug abuse in there. I mean, the bodybuilders and competitors will take steroids because that's why the women in bodybuilding sometimes look like men. But even in my realm of competing in the fitness and figure realm, girls were taking T3 to increase their metabolism to make it easier to burn fat and get into show shape. Here's the problem. Yep. Here's the problem with that. Remember that negative feedback loop I said? If you take thyroid medication and you don't need it, you have just created a thyroid problem. And now you will need medication the rest of your life. So I would see these girls after a show and they thought, oh, I'm just going to take some T3 for the show to get ready to lose the body fat. Oh yeah, they lost the body fat. Then after the show, they gained 40 pounds in like 2 to 3 weeks because their thyroid totally shit the bed, not working anymore at all. Now they need thyroid medication the rest of their life. And I saw this trainer being interviewed. He was a trainer to like the pro athletes. Like, I don't let my athletes touch T3. I mean, unless they have a thyroid problem, they're being, medicated properly by their physician. But it's like, I don't let them abuse that. He goes, I give them T2 because it's not going to shut down their own thyroid. It's going to protect their muscle. It's not going to burn muscle. It's only going to burn body fat. And they're not going to come out the other side of the show with a thyroid problem. I was like, oh, that's brilliant. Well, I'm using it with my patients anyways, but that's great that you're using it with competitors and keeping them from coming out the other side 40 pounds heavier. But that's the beauty of T2 is that it protects your muscle, it burns body fat, it won't cause a thyroid problem, it produces ATP. It does so many good things. I really believe that it is our next tool in our toolbox towards obesity because it can be taken by anybody, anywhere anybody who needs to lose weight.
As an alternative potentially to the GLP medications that are out there now.
Right. Alternative or adjunct. I mean, I'm a fan of microdosing the GLPs, but I'm not a fan of the macrodosing. And that's really where we're seeing some big issues with the standard dosing. Like, I shouldn't even say macro, the beginning dose that doctors and even functional doctors will start you on. That is enough to burn your muscle, just a whole host of issues. Now, microdosing is fine. And you can actually pair up T2 with the microdosing of GLPs.
Now, isn't that fascinating? Nobody's talking about this. This is the first time I've heard this, so I love it. Let's talk about this a little more because my God, there are a lot of people taking these medications. My husband and I were watching the Olympics recently, and he was like, "Is Ozempic like taking care of sponsoring the entire like Olympic thing?" Like we were watching it on NBC, and of course
Oh,
here in
did they
Canada.
sponsor it?
Oh
Okay.
my
I'm not
God.
surprised. Okay.
Like every like intro outro was like a little Ozempic logo, and it was crazy. I don't know. It's perhaps they're trying to tap into the non-athletic folks like me sitting on the couch watching the Olympics.
True.
In which case, genius. It was great. It was great.
Yeah, genius.
But I have to say, other than Simone Biles, probably my favorite Olympian was Snoop Dogg, but we'll move on from that.
Agree. Totally.
I had a patient recently bring in a chart with her Ozempic. She said, "This is what my doctor recommended." And she had gone, there was a reason why in her health history that I can't remember at this point that she had actually gone to an endocrinologist for this recommendation. She had previously had, I think she had a hemithyroidectomy actually. And for those listening, Ozempic in particular, I think maybe some of the others, but for sure, Ozempic has a black box warning against a particular kind of thyroid cancer in rats. It's
Yeah.
not a model done that was done in humans, but so that's why the doctor said, "I'm just going to send you right to the endocrinologist to make sure it's okay for you to take it."
Mhm.
And she came back with a whole chart that was like, this number of clicks is this amount of, as you click the end of it to get the amount that comes out. And I thought, now this is so interesting. And there had to be 100 numbers on there. It wasn't just the one or two, because I think you start at a low dose and then you work your way up so that you don't have a bunch of symptoms.
Yeah.
Fascinating. So is that what you're talking about here? Is it you're saying instead of the intro dose, you take a fraction of that?
Yes, but that can usually only be done through compounding pharmacies because the big pharma versions of, so we're talking about glucagon-like peptides. Semaglutide is one, tirzepatide is the other. I know there are other forms, like old school forms like Wegovy, but we're really talking about the newer versions that are more effective with less side effects. Semaglutide, which is Ozempic,
Mm-hmm.
and tirzepatide, which is Mounjaro or
Monjaro, yeah.
Zepbound. Yeah.
Yeah.
Now, the pharmaceutical versions of, let's just take tirzepatide. The pharmaceutical version of tirzepatide starts at 2.5 milligrams. And then you go to 5 and then 7.5, and you keep going up from there. Microdosing is like half of that or a quarter of that. So we're looking at 1.25, 1.5 milligrams. That's microdosing.
Okay.
That's in the microdosing world. That's where we're seeing, yes, the benefits of weight loss without the complete appetite destruction,
Mm-hmm.
where women are not getting in their protein. In those starting to higher doses, that's where we're seeing the gastroparesis, the heartburn, the nausea, the fatigue, and then all of these symptoms of malnutrition, like hair loss, muscle loss, Ozempic face is what they're saying, because you're losing the fat in your face because
Bone
you're just,
loss.
oh
Yes,
yeah,
all of it. Yeah.
all the
Mm-hmm.
bad things that you're hearing
Mm-hmm.
with GLPs are real, but they are in that pharmaceutical higher dosing regimen. When you look at microdosing, it's like a totally different world. Now we're seeing, oh my gosh, it's protective of the gut. It can help with IBD. It helps with the brain. It protects against Alzheimer's. It helps with mood because it actually starts to affect the neurotransmitters in the brain,
Mm-hmm.
producing more serotonin, and not
Mm-hmm.
with a big bomb dropped on you. It's just these little micro doses that are mimicking what we produce naturally. But the problem is we produce GLP naturally in very fast bursts.
Mm-hmm.
So, we get the GLP and then it's gone. Whereas these medications, these peptides are tweaked to have a longer lasting effect. So when we take that GLP in a microdose once a week, it tends to last for those 5 to 7 days before you take your next microdose. And a true microdose, you won't even know you took it. You will not have a single side effect. You won't even know it.
So is it like when you're taking the iodine, you sort of titer yourself up until you notice you have some sort of a symptom, and then this is how, go ahead. Yeah.
Yeah, no, I don't even want you to titrate up. Like
Ah, okay.
maybe we would take you to 2.5. Okay. And listen, if you're full blown type 2 diabetic, if you are
Yes.
deep in insulin resistance, then we might start at a higher dose for a while and then drop you down after you get to the goal weight, because we know, carrying around excess body fat is more detrimental than
Mhm.
having a little bit of heartburn and some nausea or whatever. So ultimately, we want to get that body fat down, get your A1C and insulin in line, and then we can talk microdosing. But the problem that we're seeing in this GLP world are women that have to lose maybe 15 to 20 pounds, and they're
Mhm.
taking these big
Mhm.
doses, and I mean, they have flat asses. They're losing their ass. They're losing their muscle. I mean,
Mhm.
I experienced that. I am
Mhm.
so open to my audience about that I tried 5 milligrams of Manjaro a few years ago when it first came out,
Mhm.
and I lost muscle and I got Ozempic face. I had to have fat put back in my face because I just went like Skeletor, just sunken in. So yeah, I mean, I way overdid it and it was horrible. So now I'm back
Wow.
to the micro dosing, and I can honestly say, hell yes, you will lose muscle. Absolutely. And I was really trying too. Like, I
Yeah.
was lifting heavy. I was taking in the protein, and it
Yeah.
still affected me.
Wow. And I have grave concerns about this very thing right here, seeing the number of people that are taking it, but have no idea how to nourish themselves properly. This is how a health problem starts. Wait till 5 years down, 10 years down the road, we're really going to see the side effects of this. So I think, like so many things, we have to be so careful about this. I know my own practitioner has suggested Ozempic for me for reducing risk of all the things, right? And I'm super hesitant, but what I wonder is if, because it's a compounding pharmacy she works in, it's a nurse practitioner,
Yep.
if indeed she would be willing to do it as a compound and a microdose. So my listeners are familiar with microdosing in terms of, on this show, in terms of psychedelics. We have talked to other experts about that. So it's an interesting concept. And of course, it's one that research is not, they're all about the big doses, and
Yeah.
because of course big pharma is paying for that research, right? We
Yeah.
have to remember that. Dr. Amie, that was a fascinating little nugget right there. I think that's going to help a whole lot of people. So I was going to ask you about weight stuff, but there we go. We covered some interesting pieces there that I think will be helpful for the women listening to the show that we're not hearing enough about. So just to be really clear to everybody listening, if you're taking these medications, it may behoove you to be on a lower dose. Your
Mhm.
doctor may be able to talk to you about that, maybe not.
I was just agreeing with you. I don't know if your doctor will be able to talk to you about it, because it's kind of it's not a new concept, but it's a newer concept in our world of functional medicine.
Yes.
So yeah, I mean, if your listeners want to hear a more deep dive on the microdosing, I did a podcast on
Oh,
it, so they can go
yes.
listen to it. As we are recording, it's releasing next Tuesday, but it will be out by the time you release this.
Yes.
And so that way they can kind of go a little bit deeper in that whole microdosing world.
I love that. Thank you for sharing that. So it's fresh in your mind. You've just recorded that episode so
I did,
recently.
yeah,
Yeah.
yeah, because
Yeah,
I've
I
been
love
going
that.
down this rabbit hole for a while. I really wanted to do my research before I spoke about it.
Hmm.
And it really, I mean, it's blowing my mind. It really is fascinating. So I think we need to get the word out. But just like anything, what is that phrase? It's like the healing or the poison is all in the dose. Like, basically,
Oh, yeah.
based on the dose, you could be poisoning yourself or healing yourself. And it
Yes.
really does come down to that for the GLPs.
Yes, yes. And I'm, as I said, gravely concerned about the fact that women as a whole, we don't nourish ourselves properly. We don't get nearly enough protein. Some of us are still stuck in the low fat business, which is absurd. We
Mhm.
know enough. I mean, I fell into that trap in the 90s, didn't we all, right? We ate a bunch of low fat shit that had a bunch of chemicals and it was full of sugar. Can you
Yeah,
imagine?
love it.
When
Yep,
we
did
wonder
that
why
too.
it's, we all did
Snackwell
it, right?
cookies, man, fat free. Yeah.
Yes, I know. I can think of those cookies right now. I can probably still taste them. It tasted like sawdust, but they were sweet, so it didn't matter.
It didn't
I was like,
matter.
they're fat free. They must be good for me.
So
So
true.
it's crazy. It's crazy. Anyways, I have loved this conversation. They've had so many wonderful things to share with my listeners, and I just thank you so very much for spilling the tea. Now, there will be people who are listening to this conversation and want to know more about you. Where can they find out more about you, please?
Yeah, absolutely. So you can go to dramie.com, DRAMIE. And that has everything on there from my services. We prescribe to all 50 states. We prescribe to Canada as well. So if you are seeking help with your thyroid and hormones, obviously we can help you. We can help you there and get you optimized. And then speaking of the T2, Fiona, I know you're trying it as well. I have T2 in 2 products. It's in Thyroid Fixer and Metabolism Fixer. And that's on my store. You can get to the store through dramie.com, or you can go directly to the store at betterlifedoctor.com. And you're looking for Thyroid Fixer or Metabolism Fixer. If you want to try out T2, see if it boosts your metabolism, helps your energy, those are the 2 products that's in it. And then, of course, the Thyroid Fixer podcast, which Dr. Fiona was the guest on as well. So you can find me pretty much anywhere.
I love it. And I'm taking both of those products, and I have to say, I absolutely love them. I very much notice with the Thyroid Fixer how much more energy I have when I take it. And the Metabolism Fixer, just it gets rid of any sort of craving or like feeling of need for hunger that I have. Like it just goes away. It's like people have described Ozempic, which I find really interesting. So I don't know if you want to take a minute and talk about how that happens. I want to know, how does that happen?
Yeah. No, so for Metabolism Fixer, our tagline is better than Ozempic, because it's not actually slowing your gastric motility, but you are getting that benefit of that increased serotonin, dopamine, that neurotransmitter that says, hey, you're okay. You don't need to eat more. And what studies are showing, so it has a trademarked ingredient called Suppressa in it, along with the T2. And then we also put herbal tea and green tea extract, both which act on the metabolism as well to help the metabolism increase. But that Suppressa, it has multiple studies behind it showing around a 69% reduction in appetite, 55% control of cravings. So we can see that it's not totally crushing your appetite like the GLPs, where literally you cannot eat, but it is taking the edge off, just like you said, you're noticing.
Yeah, absolutely. It does that. And I will make sure for the listeners that there is a link in the show notes to your store where you can get the Thyroid Fixer and the Metabolism Fixer products, because they are fantastic. Fantastic.
And I think we gave your listeners a discount too. So if they check the show notes, they'll get the discount. Yeah.
Thank you very much. On behalf of the listeners, thank you. I love that. Let's wrap this conversation. Much as you and I could talk all day, there's a couple of things I want to hear your thoughts on. There's 2 questions I end the show with. And the first is, I envision a world where women in the perimenopause transition get an opportunity to have essentially a maternity leave, but for menopause. Okay. Now, I am in Canada, and when I have posted this on social media, what my American listeners have said well, I didn't know there was a mat leave. Well, there isn't in the US, which is completely absurd, but that's another problem that the politicians need to work on, right?
Right.
In Canada here, we do have a maternity leave, and I think all of the other G7 countries all have maternity leaves as well. Again, that's an issue that needs to be worked on. But if a woman can take a menopause leave and she has complete coverage and support from her government, whatever services she needs, whatever supplements, whatever travel, whatever she needs for a year.
Okay.
How would you envision, or what would you put in that sort of cluster, that little basket of, this is what self-care for Dr. Amie looks like at perimenopause?
Oh man, that just sounds heavenly,
Doesn't it?
Like I'm thinking eat, pray, love, right?
Yeah. Oh, pasta in Italy. Good. Let me know when you're going. I'll come with you.
Well, it is gluten-free. Well, it's not really gluten-free, but it doesn't have the chemicals, so it doesn't bother us.
Yeah.
Yeah. No, so I think number one, you start off with just that self-care, whatever that looks like for you. So, I mean, I love getting a good workout at the gym. And I mean, I can imagine if I had days and days off, oh my gosh, I would structure my workouts so they would be amazing. And then I would end in the sauna, or start with a cold plunge and then end in the sauna, do some yoga, fit that in, get a massage, really nurture my body. I don't care. It could be at home. I could stay right here, or I could go on a trip. Doesn't matter. But I would really hone in on doing those biohacking things that are so good for us that when we're go and driven women, we don't take the time to do. We know we should do it, but we don't take the time to do it. So really that self-care. And then Use that time to build your hormones up, get your thyroid optimized, get your nutrition optimized, whatever you need to do, whoever you need to work with to help you do that now. So that really, I mean, if we're taking a year off for perimenopause and menopause, we get you optimized in those first 3 months. You got what, 9 months of just feeling your absolute best that you don't have to work. Let's do it. I mean,
Yes.
let's get you optimized so that, because every woman deserves to be, as I say, the badass human that they're meant to be. You deserve, our bodies were made to be vibrant and healthy. We cannot, we have to get out of this mindset that as we age, it's okay to be hunched over. It's okay for our knees to go out. It's okay for all of our hair to fall out. Like, no, like we are able to live beautiful, vibrant lives. But in order to do that, you need hormones, you need self-care, you need to fix your thyroid, you need to get your nutrition in line, you need to sleep, you need to move, you need to do all those things that you're not taking the time to do right now.
Mm-hmm.
So yes, in a perfect world with a year off, I would have every woman do that. But even saying that out loud, it's like I stop and I go, but even still, why the hell aren't we doing that? Even if you do have to work a 9 to 5 or you're working 60 hours like Dr. Fiona and I do, whatever
Yeah.
that work schedule looks like, I mean, why aren't we taking the time to care for ourselves and build our hormones up and build our body up? We all should be doing that.
Mm-hmm. I heard I started asking this question recently because I had a patient in the office that was with me in the office who's just had a grandchild born in the Netherlands. And in the Netherlands, for the first 6 weeks after a woman has had her baby, she gets basically a nurse, an overnight nurse that comes and stays with the baby for 6 weeks while she recovers. Can you imagine?
Oh
I
my God.
know. I know. Why are we not doing this?
Wow.
So this is my contribution. I want to start putting it out there in the field so eventually it will start to manifest in whatever form it is. So thank you for being one of the early contributors to this conversation, especially because we get to make it what we want it to be. And that's what I think is lovely. And yes, America does need to get on maternity leave for all women in the United States. Now, final question I have
Yes.
is, knowing what you know now, what would you tell your younger self?
Okay. Knowing what I know now, I would definitely tell my younger self to not be as hard on you as you don't be as hard on yourself as you are right now. It's that I think I saw a meme one time that said, I wish I was, it sounds so horrible. Please don't hate me. This is just a meme. I wish I was as fat as when I thought I was fat. I mean, and I think that really sums up how we think
Yes.
about ourselves as women.
Yeah.
Like, we're always thinking that we're not good enough, we're too fat, this, that, all these problems until, as you hit perimenopause and menopause, you start to look back and go, I really
I wish.
thought I was like hellish at my, in my 30s, and God, I was gorgeous.
Yeah.
Like, can I get that skin back? Can I get that waistline back? Like, and I was beating myself up every day.
Yeah.
So, I mean, I would just love to just give her a hug and be like, listen, you're beautiful right now, and you're going to be this way forever. It's okay. Things will change, but you're still beautiful. Like, don't beat yourself up. You don't need to diet like crazy. You don't need to, just all those crazy things we did in our 20s. I mean, outside of me even competing, that was a crazy diet as well. But outside of that, it was always like body hating, body shaming, another diet. What diet is, what diet am I doing this week? So yeah, I would be much easier on myself.
Me too.
Yeah.
Me too. It's great advice. Thank you so much for the time today. Dr. Amie Hornaman, thanks for joining us on the Not Your Mother's Menopause podcast. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.